Hey there. I just wanted to let you know that next week I will be offering a free live VBAC prep workshop called Three Steps to Have an Empowered VBAC, even without a supportive provider. The two sessions will be on Wednesday, October 9th at 12 p.m. Eastern Standard Time. The second session is Tuesday, October 15th at 2 p.m. Eastern Standard Time. You don't have to attend both. You can attend either one, or you can attend both if you'd like. Again, this will be live. Some of the things I'll be covering in the workshop are how to shift from fear and doubt to confidence and empowerment when it comes to your VBAC, the power of effective communication and boundary setting, and how you can still have a strong support system even without a supportive provider. This workshop is perfect for anyone, whether you're trying to conceive or currently pregnant and preparing for a VBAC. Again, the two dates currently being offered are Wednesday, October 9th at 12 p.m. Eastern Standard Time and Tuesday, October 15th at 2 p.m. Eastern Standard Time. If you want to find out more and register for one of the workshop dates, please go to thehannahgill.com/workshop. Hi, everyone. Welcome to the show. I am really excited for today's guest. I feel like this is a topic that is not talked about enough, and today's topic is the NICU. So our guest for today is Mary. She is a board-certified NICU nurse, nurse educator, and a mom of two sweet girls. She has over 10 years of experience working in NICUs with the highest level of acuity, and over these years, she has had the honor of working with hundreds of families during their most vulnerable time. Every day, she is humbled by the strength and will of these fragile babies and the immense love their families have for them. She recently had her second daughter and struggled with postpartum anxiety and depression. The immense feelings of overwhelm she experienced highlighted the struggle of the NICU parent, and she felt called to explore a path to new ways to support them on their journey. She started the NICU translator to help bridge the gap between the NICU and a life at home. She works with families to create a unique plan that will guide their transition from the NICU to home through one-on-one coaching sessions and voice and text support. She offers the nurturing guidance and support of a postpartum doula combined with the knowledge of an experienced NICU nurse. Rather than feeling cut off from the supportive NICU environment, she can help families feel empowered to care for their baby and have their questions answered by a NICU professional. She believes that NICU families deserve a joyful and positive homecoming experience, and she is committed to building a community of support that will make it a reality. I'm Hannah Gill, and this is Motherhood Flow. Hey, Mary, welcome to the show. Thank you for being here today.
Hi, I'm so happy to be here.
So if you could just go into kind of who you are, where you're from, and how you got into the work you're doing currently with the NICU content and how that all started.
Sure. So I am currently in Central Virginia. I'm originally from upstate New York. I am a second degree nurse. So my first degree, I studied sociology and pre-law and minored in Italian, which not really helpful. But I always knew that I wanted to do something directly, like working with people and making like an impact in the world. So I went back to nursing school, initially wanting to be a nurse midwife. And while I was in school, I did doula training and I worked as a free doula for low-income families and did that for a little bit while I was in nursing school, which was really fun. And then my first job offer, I was told that there was nothing in L&D, but we do have NICU. And it was in the hospital I wanted to work in. And I was like, I guess I'll do it for a year. I don't know, see how it goes, transfer to L&D, go back to become a nurse midwife. And that was 11 years ago. And those little babies have wrapped me right around their fingers. And I've never looked back. So I still have some heart in that doula kind of role, but I've always worked in the NICU as a registered nurse. So since I started my nursing career, I worked at the bedside at Level IV NICUs, which is the highest level of acuity NICU. And I served both at the bedside as charge nurse, and then most recently as our unit's nurse educator, where I focus on creating curriculum for new hire nurses and families to kind of learn about the NICU, because you really don't know anything about it. Even in nursing school, they really don't do a lot of training on the specifics of the NICU. So I worked there for a while. I love working with the population and the families, but I started to get frustrated with the limitations of working within a healthcare system specifically and trying to make changes changes from within, knowing the right thing to do, and all the red tape around it. So after I had my second daughter, she's now almost 20 months old, I went back to work post maternity leave and just felt so frustrated and kind of had like a mini existential crisis, which I'm pretty sure, I know looking back on it was very linked to postpartum depression, kind of a delayed onset postpartum depression, and sought therapy finally, which was hard to get to, but did it. And then eventually figured out that I meant to serve families in a different way and to kind of like work outside of the healthcare system to create a resource that I know is so needed. So I started the NICU translator about a year ago, and I help families transition from the NICU to home. So I kind of bridge the gap between the 24/7 care and support of the NICU and basically that feeling of being like, here's your baby, off you go deal with the real world now. So I help bridge that gap in between and kind of connect the dots and help empower families to feel confident in the knowledge that they have and skills that they have to care for their babies after the NICU. So that has been my work in the past year or so, and I've loved it so much. It's been so wonderful.
So I love that your background, like in your first degrees, you have a very wide range of experience. And I love that not only one, because like that just shows like you were able to find like something you were truly passionate about, but I have a very similar experience. So like my bachelor's is in human biology, my master's is in forensic science. I wanted to go to medical school to be a forensic pathologist. And then I had kids,
Mhm.
and that's how I got into birth work after my birth experiences, and had nothing to do with what
Right.
my degrees were in, but having a family and doing that just completely changes you and kind of what you feel your calling is. And in my master's, we covered a lot of like law stuff too.
Mhm.
So it's very interesting, like how there is a little bit of overlap there. And then you also trained as a doula, and I am also a doula. So that is really neat that you were able to kind of find your way to NICU kind
Yeah.
of like unexpectedly.
It's funny when you're living that transition, I feel like you're like, what am I doing? But now looking back on my past 10 years, I'm like, oh, like it was all kind of stepstone building and I needed one to have the next. And so
Hmm.
sometimes even today, I'm like trying to look back on this time, be like, what am I doing now? Like, what's it going to look like when I look back at
Right.
this?
When
But
you're when you're in
motherhood
the
totally
moment.
changes everything.
Yeah. Oh, it does. Like I thought I was like, okay, I'm gonna go to medical school. Like I'll have kids like during residency and like it'll all be good. As soon as I had my son, I was like, I don't want to
Yeah.
go back to work. I mean, I did, but I didn't want to go back to work. And I didn't want to go back to medical school. I didn't want to like continue like that process of trying to get into medical school. And it was just like a major shift for me. Um, but as far as, like you said, your experience with the NICU, so I worked as a CNA in a NICU, a level 4 in Omaha. And I feel like even from that experience, working there with all the NICU babies and the families and stuff, didn't even prepare me for like what the NICU could be like as a parent with a child in the NICU. And obviously I didn't know like all the statistics and research and all of that behind the like what are the like from your experience, what are the chances that a baby could end up in the NICU? Because so many families, and me included, think like, okay, your pregnancy's healthy, uncomplicated, your birth went smoothly. So why did my baby end up in the NICU? So what are some of like the major factors that could contribute to a NICU stay, especially if you're not really expecting it during pregnancy?
Yeah, that's something very, very common that I see at the bedside when a baby's admitted to the NICU is this sense of shock and be like, how in the world did this happen to me? Thinking that it only happens in super rare instances. But the reality is that it's in the United States, it's 1 in 10 births annually require the baby will require a NICU stay. So it's about 400,000 babies every year just in
That's
the
a
US.
lot.
Yeah.
That's
So
more than I was expecting.
it really is. And I think part of the where our system is failing families is that it's not acknowledged really at all prenatally. So
Mm-mm.
that when it does happen, it feels like it's this like true just like disaster. Whereas like in what do you think? Reframe it a little bit and thinking like, okay, some babies just need help transitioning. They go from living in this like bubble environment where everything's done for them. And it's hard to be in the real life and have all their organ systems function and gain weight and breathe and pee and poop and do all these things. So sometimes they just need the NICU as a bridge. So kind of, I feel like reframing that can be helpful. It doesn't decrease the trauma of like being separated from your baby, but knowing that it is quote unquote slightly normal or not,
Right.
like kind of destigmatizing it can be helpful. But the most common reasons for NICU admission, most people when they think of NICU think of preemies, of prematurity, and that is roughly about 50% of the average NICU admission like reasoning. So preemie is any baby born before 37 weeks is considered preterm. Typically, if they're less than 34 weeks, they're more of like a regular premature baby, and then anything less than 28 weeks is typically extremely premature. And most level 4 NICUs now are resuscitating infants or offering that as an option families as low as 22 weeks gestation. So that is something that's very common. And those babies tend to have very specific needs, kind of based just on the fact that they didn't have enough time for all their organ systems to.
Right.
So they need support with breathing, they need support with feeding and blood sugar management. Sometimes they're at a higher risk for infection, and we just basically need to grow them to the point that they would be at when they were born, if they were born full term. So that's like the more known reason. Other reasons, about 50% of babies are term. So those sometimes they're congenital issues. So sometimes families do know prenatally based on like an ultrasound or some type of genetic testing that their baby has something going on, either with their a lot of times it's a heart type congenital heart disease picture or other type of organ kind of differences. So they will need either like a short NICU stay for observation, or sometimes they know they're going to need surgery post delivery. So those families still typically kind of know what's coming, but it's still a good chunk of the babies that come in. And then there's other things that going on like during delivery. If you had more of a traumatic delivery or some type where the baby had a loss of oxygen or exposure to some type of an infection picture, they will likely need to come to the NICU for observation, sometimes antibiotics or further testing. And then a lot of times jaundice is a huge reason for
Mhm.
admissions. That is there's different reasons why a baby would be at higher risk for jaundice versus one versus another, and might need more intensive phototherapy. And then the other really common one is there's two that kind of go hand in hand a little bit, are respiratory distress. So that's just having hard time basically with their lungs turning on. And
Yeah.
sometimes it's related to prematurity, sometimes it's related to their birth, and other times it is just something that they need a little bit of support with. They need to kind of like dry out their lungs a little bit. And then hypoglycemia, so low blood sugar, which is typically linked to babies that have mothers that have gestational diabetes, type 1 diabetes, or type 2. They sometimes just need a bridge in letting their pancreas basically learn how to regulate their own insulin. So those are the common diagnoses, and there's like layers and variations within. No two NICU babies are exactly the same. They may have similar diagnoses, but there's just a lot of different factors that go into a NICU stay. And babies can stay as short, sometimes as 4 hours. And then we have some babies that celebrate their first birthday in the NICU.
Mhm.
So there's just a huge variety within that.
See,
So,
and I feel like you said, prenatally, there's no education really on it. Like in childbirth classes and even like breastfeeding classes, there's even guidance from like your OB. There's no talk about NICU ever.
no.
And I feel like everyone just assumes like, okay, if my baby's premature, they're going to go to the NICU. But if they think, okay, if my baby's term and there's nothing found during pregnancy, then why would my baby need a NICU stay? They may
Mhm.
not realize what could happen or that it's even a possibility for them. And with me, like I would have assumed like my first child, it was a traumatic unplanned C-section, and I would have assumed he would have likely ended up in the NICU versus my daughter, who is uncomplicated pregnancy, uncomplicated birth, like no problems. But she also, I don't know how common this is. We went home first for a week, and then she ended up in the NICU afterwards. So it wasn't like a direct admit to the
Mhm.
NICU after birth, which I feel like that was even more confusing to me. Like,
Right.
we've been home for a week. Why is my baby needing to go to the NICU now? Why wasn't whatever this is going on like caught like when we were at the hospital? So how often do you see like people going home first and then coming back to be in the NICU?
It's not as common because as you were saying, a lot of times the reason is known early on, at those first early assessments, they're like maybe having a hard time breathing, or they're showing other clinical symptoms, or they were just born early. But it does happen, and those are typically babies that go home and are maybe being like watched a little bit closely by their pediatrician for something going on, and then it's like, okay, we need to intervene. And typically, not all hospitals are the same. Some will never admit from the outside to the NICU. They will always go to the PICU. So that's something to think about also, because they consider those babies, once you're home and exposed to other like environmental things, bringing potentially like an infection risk into the NICU. Sometimes
Yeah.
they don't
They
think.
call it at the hospital we were at the dirty NICU. I know that
Yes,
sounds awful,
yes.
but yeah.
No, it's true.
Like
So
there's the
yeah,
direct
there's
NICU,
the
like
ones
if
that
you've
come right out and
stayed.
come right in,
Yes,
and there's
yeah,
others that played outside for a little bit and then come
yeah,
in. So some do send those babies to the PICU, the pediatric intensive care unit, but others come to the NICU. Like my hospital, there's kind of a threshold, a little bit of gray area, but most of the time they do come to the NICU
yeah.
and needing observation. So it's not as common, but it's also not unheard of. Oftentimes they'll be seen in clinic, like that's adjacent to our hospital, and then we'll
Hmm.
be hearing, okay, they're cold, they have high bilirubin, something's going on, and they need to come directly to the NICU. Or sometimes we will admit through the emergency room also.
Okay.
Um,
That's how we were admitted. So what they originally thought. So I was GPS positive during my pregnancy, and I did opt to get the antibiotics, but my labor was so fast, I only got one round, and it really wasn't even enough time to get that first round fully in. So originally they thought that my daughter had an infection from the group B strep at the first hospital we were at, and then we were transferred to a larger, like pediatric focused hospital, and they had said she had like respiratory infections,
mm,
and which would have made sense because I was extremely sick at the end of my pregnancy, and during labor I had a very bad infection. So that would have made sense, but I kind of got both answers, and I never really got like a 100% this is what it was. But a week after we got home, she had like a really, really high fever. We went to the ER. They did a full sepsis workup, which was like the most traumatic thing I've ever had to see, like my newborn baby getting a lumbar puncture.
mhm.
Not fun.
No.
But, and so I was just so confused. I was like, what is happening? And when forever, it took them a long time to actually find answers. And that was really frustrating. So I feel like not that it would be better to know ahead of time like what the problem is, but that it was just really hard not having an answer for what was
Mhm.
happening. Even just the short week stay we were there, just not knowing the actual cause of what was happening, especially since it wasn't directly after birth. So I didn't know for sure what was going on. Um, so do you find that, like, as a nurse in the NICU, like, what is the best way to help parents, like, as they're being admitted to the NICU,
Mhm.
like, when they're in that state of like concern and worry and scared, and like they don't know what's happening and what's going on with their baby?
Yeah, I think that is it's super scary to have to like basically turn over care of your baby to anybody. And in the NICU when they're like living there and they're not in your arms anymore, and you kind of like lose that autonomy as a parent, like really the second you set foot in the NICU. And most NICUs do a really good job of incorporating family-centered care and involving the parents as much as possible, but there's still this like lingering patriarchy type model that is our medicine. So I think as a parent, the most important thing or some of the important things that you can do is establishing yourself as a care provider, basically, like someone who knows your baby best. So ensuring that in the beginning, you know who's who on your medical team, who is the nurse directly communicating with, who is that provider like responsible to. Because oftentimes in teaching hospitals, there's certain hierarchies of who's the decision maker, who's the
Hmm.
final decision maker, and kind of that will determine your course of what happens. So knowing like who's who and who's making decisions around there. You also really want to know about rounds. So rounds are when the medical team comes together, typically once, sometimes twice a day. They collaborate with the nurse, the different physicians, nurse practitioner, respiratory therapy, nutrition, PT, OT. They typically all come together and talk about the plan for the next 24 hours. So parents in most hospitals, if they do not invite you to rounds, I would ask if they
It's
don't
early in the
overnight,
morning too.
you
Just
say, I'm
side
coming
note.
around. What time are you doing rounds? Because that is when you're getting the most input in what's
Yeah.
going on in your cares. If you don't go to rounds, I mean, life happens. People have other kids and other things. Ensure that you're getting a provider update each day where you are voicing your concerns and your questions. And the most helpful thing, especially when you're freshly postpartum and half of your brain came out of your body when you had your baby, is to write down your questions and have them
Yes.
formally written out so that you know what your concerns are and your questions so that you can immediately address them. And typically, if you are a family that is showing like super involvement in your care, you're going to get that reciprocated type of like collaborative type of conversation. And maybe some extra like time to explain pictures. So you can always ask,
Mhm.
like, can you show me the X-ray? Can you tell me what you're seeing? Can you tell me what you're thinking when you pick this course of treatment? And I always suggest that families use, just like they maybe did in a prenatal course or learn from their doula, the brain model,
Yes.
benefit, risk, alternative, information or intuition, and nothing. So asking those questions, like, what are the benefits of doing antibiotics right now? What are the risks? What could we do differently? What would happen if we did nothing? So you do still, it's not as a parent in the hospitalized type setting that you as the parent have authority in decision making, but you still do. So
Mhm.
as long, keep asking questions thoughtfully. Like you don't want to come at a healthcare provider because we're all there to try to do the right thing. But if you think about it like collaboratively and curiously, I feel like then you're going to have a better grasp and a better understanding of what's going on. And if you as the mother are not in a state to do that because you are exhausted and bleeding in postpartum, have a designated second person who can be your eyes and ears. Even during rounds, if you can have more than one person come with you, so helpful because you're going to hear different things, you're going to ask different questions, and just having that trusted person can be super, super helpful.
If you are preparing for a VBAC, I have put together a free guide to help you in your preparation. It's called Preparing for a VBAC, Your First Three Steps to an Empowered Birth Experience. This guide will walk you through the first three steps that you need to make on your VBAC preparation journey, and it'll make the whole process a lot easier and more straightforward for you. So if you want to grab that guide, go to thehannahgill.com/first steps. Again, that is thehannahgill.com/first steps. Yeah, I know this is not feasible for everyone, but I was one of those people that I did not leave that NICU room unless I absolutely had to. I mean, I was postpartum. It's not like I was working. My husband stayed home with my son. And basically, when I needed to shower or when I wanted to go see my son, my husband would come up and
Mhm.
we would not leave her alone, like ever, unless we absolutely had to. So like you said, I was exhausted. I was healing from just giving birth and I was sleeping on that uncomfortable NICU couch every day and night. So, but also you mentioned rounds, and there were
Mhm.
like 10 people that came
Oh
by.
yeah, yeah, it's like
And
a train.
yes, it was like it seemed chaotic. Everyone was really quiet, thankfully, especially that early in the morning. But just seemed really chaotic. Like there was so much going on, so many people talking,
Mhm.
but being able to like hear what they were saying because
Mhm.
I do. A lot of people don't, but I do have a medical background, so I understood a lot of what they were saying. But even then, I still needed to ask a lot of questions, and
Mhm.
I feel like I've had friends that are NICU nurses themselves that have had children in the NICU, and they said their experience is completely different
Mhm.
as the parent versus the nurse that's caring for the child, and they even have to ask questions like what's happening. So it's just really interesting to see it from that side of things. Um, but so that's kind of helpful for someone that would be like an unexpected NICU
Mhm.
stay. But say someone has like a complication during pregnancy where they know like, okay, my baby's going to need a NICU stay.
Mhm.
What can they do to prepare for that during pregnancy ahead of time so it's not like as overwhelming? And of course, it's still going to be scary in
Right.
making them worry, but what can they do to prepare themselves ahead of time?
Okay. I think some helpful things would just be familiarizing yourself with the environment. So if you're NICU offers a tour, then I would absolutely do that. So you can visually see like where your baby likely will be, what the equipment looks like, kind of see a couple familiar faces. So when you are admitted, you can be like, oh, I saw this doctor. Even if you saw the front desk person that checked you in, sometimes seeing that familiarity can be helpful. And then asking specifically what policies they have in place. Like, what is visitation look like? What are visiting hours? What can I eat in the NICU? Can I not eat in the NICU? What that looks like, so that you can kind of have a game plan in your head about like who's going to visit with you, who's going to be your support person, who's going to be the baby support person. Thinking about that at the delivery. Sometimes the NICU is not in labor and delivery, so the baby and the mom typically have to be separated. Who goes with the baby, who stays with mom? A lot of times if they haven't thought about it, there's like this, like, I don't know who goes where, I don't know who goes what. And it's just like this like panic feeling. So if you already like have that kind of thought out, great. And then communicating, having that as a part of your birth plan, knowing like that you're going to have this initial separation period, but anything that you maybe still want to incorporate. So making sure you're saying any immediate postpartum requests, like you do or do not want XYZ medications. You would prefer to have like the first bottle breastfeeding experience be with a parent, which seems so obvious, but really doesn't always happen that way in the NICU. So just making sure that you're clear with your expectations and your interest of thinking about that beforehand can be really helpful. And then building your support system beforehand, like who's going to walk your dog? Who's going to feed you? It's like postpartum experience, but heightened because you're not at home. Who's going to take you to and from the hospital? And I also always suggest like having one person be the update, because as you probably maybe experienced, when something wrong is happening, everyone's over in your world is like, what's happening? What's happening with the baby?
Right.
What's going on? Are they okay? I don't know. What's the update? What's this? What's that? And as a person, like a parent, you don't have time to deal
Yeah.
with other people's anxiety and worries and concerns. And they don't technically, like, you don't have to worry about them, but if you want to ensure that they're updated, I suggest families have one person that they're giving their update to, or have one Facebook page or one like page where you post your daily update and then you don't think about it anymore. Like I'll see families sitting at the bedside constantly texting everybody and not wanting to do that. Like they want to be there visible, like present with their baby. So having that clear expectations beforehand can be really helpful. Like, this is the time of day I'm updating everybody. If you don't hear from me, don't worry. It just means I'm busy.
Yeah. I think that's a
Protect
really
me.
good point. Yes. Same with like birth. Like you don't
Yes.
need to be texting the mom while she's
No,
laboring,
you sure
trying to figure out
don't.
what's happening.
That information is a nice to know. It's not a need to know.
Right. Um, I love that you brought up breastfeeding because that's one point I wanted to specifically touch on because I hear from so many women that my baby was in the NICU. I can't breastfeed. That's not an option for me. I have to do formula. And so many women feel like the NICU stay kind of sabotage their breastfeeding experience. Some they've said that like some hospitals are very pushy towards formula with NICU stays and babies. And that is one thing for me specifically that I was like, no, I am breastfeeding and that is what I'm doing. Thankfully the hospital I was at was never like questioning that. They never, but also my baby was term, didn't have issues eating or anything like that. But while she was getting her EEG, she obviously had to be like in the bed. I could not move her. So I was literally like over her NICU bed, like dangle feeding, like making sure she was still able to breastfeed whenever possible. So how, from your experience, do you feel like there's not a ton of support for breastfeeding in the NICU environment? Is it kind of dependent on the hospital, or what has your experience been?
Yeah, that's a really interesting. I will say, with full blown honesty, it will impact your breastfeeding experience depending on the gestational age and the specific medical needs, but it just changes it. It doesn't necessarily sabotage it. So if you have a preterm infant, you want to make sure that if breastfeeding is your goal, that you start pumping nearly immediately after delivery, because likely, especially if they're less than 35 weeks, they will not have what's called the suck swallow reflex coordination to transfer milk from your breast to their body. So if you just relied solely on breastfeeding your preemie, you're not going to establish a milk supply that's going to support them in the long term. So knowing in your head, like pumping is going to be a part of your breastfeeding journey in those early days. And so if you say you like had a preterm birth scare, like start learning about your pump and pumping experiences and maybe researching that as part of your prenatal learning journey. So establishing early breast pumping in the NICU is essential. We treat breast milk as a liquid gold medication in the NICU. So we prioritize breast milk as much as possible, especially for critically ill and premature babies, because we know that it is just easier for these babies to digest and has those magical other types of, beyond what formula it has. It has the good bacteria, it has all the different macrophages, all the good things that formula just doesn't have. So if you have a premature infant, like in my particular unit, if you're born less than 28 weeks, your baby will get breast milk, whether it is your breast milk or donor milk. Like you really have to have like strong feelings of why that isn't the case, because it's just safer for these babies. But again, it's still going to be pumped milk, and they're going to be
Hmm.
fed with a tube that goes into their nose, kind of taped onto their cheek and into their belly, because they cannot transfer it safely themselves until they're closer to term. Well, if you have a preemie and then you're getting closer to term, there is still going to be this emphasis on bottle feeding in addition to breastfeeding. And there's
Hmm.
two reasons for that. One, again, they have an immature sex, really three, immature sex swallow breathing reflex. So the speech language pathology team, or SLPs, are typically people that will come in and assess your baby's oral skills and oral readiness. And they can do that at the breast, but they will also often like to do that on a nipple and see how they transfer milk. Do they cough? Do they have any aspiration type symptoms, to make sure that they're developmentally ready. Then there's the reality that, like, if you are here for months, weeks, months, you can't really be at the bedside 24/7 safely. So someone else's nurses specifically are going to need to feed your baby milk. So having those bottle feeding skills in addition to breastfeeding skills is going to ultimately make your discharge faster. Um, because if we're it's just kind of that in between time of like, who's going to feed your baby. If you have a short stay and you can breastfeed the whole time, 100% do it. If you have that longer stay and you're going to be coming home back and forth. And then premature babies are often sent home on fortified breast milk, because they need that additional calcium, phosphorus, and protein that they would be getting in the late stages of fetal development in utero to have bone mineralization. They don't get that just from breast milk, so they add fortifier in. So they will still need 1 to 2 bottles of fortified breast milk a day, even if they're exclusively breastfeeding at home, to ensure that they have the complete nutrition until they get closer to like developmentally corrected, like 3 months old, roughly, is
Okay.
usually when they switch off of that. If you have a term baby that's admitted to the NICU and can breastfeed, we support that as much as possible. The tricky bits come in with hypoglycemia, so babies whose blood sugar are super low. If breastfeeding is still your goal, again, if you are in a level 4 NICU or someone who has the resources, we offer donor milk to those babies also. So as a bridge to your supply coming in, they might not be able to maintain their glucose levels on exclusively colostrum because of their clinical picture and their insulin levels and their hyperinsulinemia. They're just like, they just suck up sugar in a way that a regular non-baby with this issue would have this problem. So they will need likely to have like a bridge with donor milk or sometimes formula. But expressing your wishes and emphasizing it over and over again is super powerful. Like you should listen to your healthcare team's advice. You should soak it in and absorb it, but do your own like gut check, basically,
Yeah.
like, and keep asking. Most NICUs also have access to NICU specific lactation counselors, IBCLCs,
Hmm.
that are for the NICU. So when can I speak to them? Like, what can we talk about? They can watch a preemie feed. Just knowing that if it is a NICU stay, it may shift your breastfeeding journey. But I've seen many families go from this like inter bottle feeding, nipple shield, kind of hodgepodgey discharge feeding plan to exclusively breastfeeding within a month, to even sometimes it takes a few months for them to transition out. But
Yeah.
if it is your goal, it is still feasible. It
Yeah.
does look different though.
I
So
love that
kind of
you,
changing your expectations a little bit can be helpful.
yeah, and I love that you brought up donor milk because
Mhm.
I feel like a lot of, even for non-NICU families, a lot of people don't realize donor milk is an option.
Mhm.
And especially in the NICU, I would have thought like donor milk wouldn't be an option for NICU babies. So I love that you brought that up because
Yeah.
that can help the process.
Most
So
don't, just to clarify, most donor milk in the NICU comes from hospital milk banks. So
mhm.
families donate their breast milk to a milk bank that's associated usually with the Children's Hospital. There's usually some in each like part of the country, and they pasteurize the milk and dose it out and then ship it frozen to NICUs all over the country. So if you
Mhm.
are someone with an oversupply and you want to help critically ill babies, look for a milk bank in your area and you'll be helping micropreemies in your area. So it's just something.
Yeah, and a lot of people don't really understand donor milk anyway.
It's
So
just different.
yeah, people think like, oh, that's weird, or they don't understand like the logistics behind it and how it works. It's not like some random person is just
No,
like giving you
no,
giving
that's
you
fine if
your
that's your own time and out in the
right, but for
community.
the
But
NICU,
for the,
yeah,
yeah, for the medically fragile babies, we're really particular in
right.
background, basically medical background checking the donors and making sure that we're not transferring anything.
Yeah.
Only the good stuff for the babies.
So as far as so that period where they're transitioning home, so
Hmm.
from the NICU to home, um, what can make that easier on parents for that transition, especially if they've been there months or up to a year, and that's like their new normal?
Hmm.
I'm sure it has to be like a big transition to go back to an actual normal versus like the NICU normal. So what can parents do and like what could help them in that transition process?
Yeah, so it's definitely the graduation day itself is typically this like massive celebration. Everyone's so excited. Parents are usually like, take my baby and I'm running out of here. Like, I'm going, I'm going, I'm going. And then since I've started to work family with more families after NICU, the things that I see families most struggle with is like once all of the fight or flight hormones kind of settle down and wear off, they're often left with this like massive emotional burden of
Hmm.
like, what in the world just happened to me? So we can talk a little bit about the logistics piece, but if you are a NICU parent transitioning to home, expecting that you are likely going to have some type of a mental health adjustment and need. It's estimated that about 80% of families that have a NICU stay have either some types, either postpartum depression, anxiety, postpartum OCD is really common in NICU families, and about 30 to 45% of NICU families have true diagnosed PTSD. So knowing that you do not have to just fake it till you make it, you do not have to power through, you should expect it. If you can establish care with a provider before you go home, that is setting you and your baby up for success because you cannot be a super involved participant. Like you can't be your best parent unless you're taking care of yourself. And I know that sounds super cliche, but if you can have that moment while you're still have a little bit of mental clarity and take care of the future you now, that's going to pay off massively in the long run. Because for my own, I I preached that for a while for with families, but since I had my own experience, when you're in the thick of a depressive type episode or anything, it seems nearly impossible to think about the work of having to find a therapist or having to
Hmm.
offer help. Like that seems like the hardest thing I could possibly do. Like
Yep.
impossible. And that's when you need it the most. So if you can do it beforehand, read, talk to your NICU community and your NICU nurses. Like, do they have a family stress clinic? Do they have a maternal mental health clinic? Like, get on the books now, so you can be prepared and be as mentally well as possible. Logistically, I feel like something that you can, if you can at all, is find someone else who has a NICU experience that can be your person to talk to and
Hmm.
vent to. Because if you don't have that, people, as you know, like you don't get it unless you've been in that space, like as a provider or as a family, and other people in your life may offer advice or suggestions or say things that maybe are they think are helpful but are possibly maybe hurtful. So having someone that you can like vent to that gets it,
Hmm.
super helpful. So part of my like post NICU support, we do some logistical like talking about bottle feeding and breastfeeding transitioning and reflux management. Reflux is like the bane of every NICU baby's existence. It's something that most families have to work through, and we talk about troubleshooting that. But another thing that I just do is I just like listen and offer like NICU knowing support because it's a whole language, it's a whole world.
Right.
And once you're out of it, once you had like a lot of people form like really strong connections with their NICU team, and you just like
Hmm.
don't have it the same way. So I feel like finding your people, seeing if your community has a NICU support group or like support circle, and then being a little bit strategic with your pediatrician selection, I feel like can also go a long way.
Hmm.
Um, if you have a medically complex baby, not all pediatricians are going to feel comfortable caring for them in the
Right.
same way that someone else would. So having that, like, just because it's like who your other child saw or someone recommended them to you, like before you had a NICU stay, call them and just ask, like, what's your experience with a preemie? What's your experience with a baby on oxygen or whatever's going on? Because not all pediatricians are trained in
And
NICU
that
and
specialized stuff.
other.
Yeah.
Yes. So just setting yourself up for success that way too. And then treating it like it's your postpartum period. So that's the time, like a lot of times people are getting support while the baby's in the NICU. People are checking
Hmm.
in on them. They're giving them gift cards for food or whatever it is. But then the baby goes home and people are like, oh, they're fine. They're great. They're doing
Right.
their thing. Everything's fine. But that's when like a lot of real hard happens because you don't have the support of the NICU.
Right.
You don't have breaks, even though you don't really get those in the NICU, but you don't have anyone else. So if you
Mhm.
can express that to families beforehand, like say like, this is when I need my meals trained.
Yes. Yeah.
This is when I want you to come in and check on me and like ask for help. I
Yeah.
know that's hard to say because not everyone has the same built-in support structures, but trying to figure it out a little tiny bit beforehand. Because as you might know, discharge day sometimes comes up out of the blue. Like it'll be like last week, oh, you're going to be here for another 3 weeks. And then all of a
Hmm.
sudden the light bulb goes off or whatever was going on is resolved. And you're like, oh, you're going home tomorrow.
Yeah.
I'm like, what? So having a
But
little bit of thinking about the future, because in the NICU, you're so hyper focused on the minute to minute, staring at the vital signs changing, like all
right.
those pieces of it. But know that you're the NICU, my like favorite thing to share is like the NICU is just the beginning. Like it is
Hmm.
just a chapter of your baby's story. So keep keep the hope, keep looking on to the future, look at other families and babies and see how far they've come because it's really babies just thrive at home and they just it's just the beginning.
Yeah. And I love that you brought up like the mental health aspect of it and like the depression afterwards or any type of mental health situation afterwards because it's such a transformative and like life altering experience to go through, no matter if it's a week or a year.
Yeah.
In one situation, I don't know if you follow her on Instagram that I think of specifically is Erin from the Natural Minded Mama.
Mhm.
So her whole life has completely changed. Her outlook on things has completely changed. And she's gotten a lot of like hate for that. Like she's not so naturally minded anymore, even though she is. It's just her whole life changed during that NICU stay with her baby. Um, and just knowing that it can have that impact on your mental
Mhm.
health. It's not just your baby, it's you too that's going through this
Mhm.
process and your whole family and whoever is directly impacted by it. So just knowing that that could be a possibility, because you may not have had any sort of depression or anxiety otherwise if your baby wasn't in the NICU. Maybe
Right.
you would have had a completely normal postpartum experience. So I love that you brought that up because a lot of people don't think that that could impact them. It only impacts
Mhm.
their baby.
Right. Yeah.
Yeah.
And typically when you're in the NICU as a parent, you are so hyper focused on the well-being of your baby. Like you're that is it. You can't think of anything else besides your baby. So the symptoms don't usually show up while they're in the NICU unless families are there for longer. And then I see them starting kind of come in around the 2 month mark if it's going to happen. But it's when you get home that things kind of settle down and it all kind of comes flooding in and all of that like trauma and intense feelings and loss. There's a lot of loss that
Hmm.
happens with the NICU because you're grieving what you thought was going to be your postpartum or birth experience and it didn't happen the way that you wanted it to or envisioned it.
Right.
And you maybe there's always some feelings of like confusing feelings of guilt and shame and like what ifs, what if I did this choice? What if I did this? What if the providers did this? And so there's just a lot going on to kind of work through and talk to somebody about to kind of get that mental clarity and support that you need
Yeah.
to get through that type of traumatic event because a lot of times you're right, even if it's an hour, it's especially if it's unknown, it's a loss of
Yeah. And that's that was the hardest part for me because my first actual birth experience was extremely traumatic. So my goal and my hopes for my second birth was like, I want a positive, like empowering birth experience. And I got that. My birth was absolutely wonderful. So when we ended up in the NICU, I was just like, what the heck? Like what just happened? Because I thought, oh, it's all in the past. Like I got my birth experience. It was positive. Like we're good from here on out.
Right.
So I was just really confused on like I don't understand why my daughter ended up in the NICU when everything went so beautifully for the pregnancy and birth. So just knowing that like that if I would have known that was a possibility, kind of like with my first birth, if I would have understood that a C-section was a possibility for me, I would have been able to grapple with it a little bit better and
Mhm.
kind of like process it more. Um, so I like that you really focus on that transition home in your work because your that NICU stay becomes like all encompassing while you're there and you
Mhm.
don't think about anything else. You don't even think about, okay, what are we going to do when we get home? You're just thinking, are we going home?
Yeah, I want
That's
to
what you're,
go.
yes, yeah.
Mhm.
So I love that you focus on that transition from NICU to home because it's much different than the transition from birth to home without a NICU
Mhm.
stay.
Yeah.
Um, so where can people, or first of all, do you have anything else you wanted to bring up before I tell people where they can find you, how they can work with you, and that
Yeah.
type of
Well,
thing?
something that kind of piggybacking off of
Hmm.
what you said is like wishing that you knew beforehand. One
Hmm.
of the things that I'm working on in the next coming months is creating a course for doulas to have a better understanding of the NICU, both prenatally during a NICU stay and that transition home, so that you can have these conversations with families because the OBs don't have NICU training. Like they don't.
Right.
They don't really, some of them don't have never even set foot in a NICU in their entire life.
Hmm.
That is truly
Because it's not their specialty.
it is not their
They don't need to.
specialty. They do not need
Yeah.
to. So they're not typically comfortable speaking about it prenatally. So having that support person that you trust, like your doula, maybe having like a very basic general understanding of the NICU and how you can make the NICU experience more empowering and more supportive can go a long way. So I'm creating that course and hoping to have it live sometime mid to late summer so that NICU or doula and other providers like newborn care specialists, postpartum doulas, birth doulas can have that training so they can help support families and change the narrative of what prenatal knowledge of the NICU is because
Right.
it's just not there now. So I'm
I think
working to make it better.
that's such a good resource because doulas, obviously there's a ton of different types of doulas, but just having even like a birth doula, or even a postpartum doula, having that knowledge so they can at least have those conversations ahead of time with their clients, and kind of bridge the gap between like
Mhm.
when the birth happens and to the NICU stay. That would be a wonderful training and resource because mm, I don't think any doula training organizations like have a NICU component to it. So I think that
Not
is
in
a
childbirth
wonderful
ed
resource.
classes. It's not
Right.
anywhere. And it needs to be like it needs to be a balance between fear mongering and causing anxiety in families and empowering through knowledge and education. And that is
Right.
what I want. I want people to feel like, oh, if this happened to me, I know exactly what I would want to do. So you don't have to have this frantic shock and anxiety type feeling.
Yeah. And like just, yeah, like the shock, especially because like you said, not fear mongering, not saying like, oh, your baby can be in the NICU, you should be
Mhm.
scared of this.
Yeah.
But just knowing like this is what it is. This is why babies may end up there. This is how you can kind of navigate it. I think that is a wonderful, wonderful resource to have. So yeah, I will link that in the notes for the episode. So I also wanted to let you all know that Mary has officially opened the waitlist for her new training program for doulas, and this is NICU specific. So the program is called Navigating the NICU for Doulas, supporting families before, during, and after a NICU stay. So this could be relevant to birth and postpartum doulas, any sort of professional that is going to be supporting families during the pregnancy and postpartum period. So again, the waitlist is open, and if you join the waitlist and you do end up enrolling in the training program, you will receive a special discounted price. So once you join the waitlist, you will be communicated with via email about when registration will officially open for these live virtual trainings. I will drop the link in the show notes for that waitlist if anyone is interested. Again, this could be applicable to both birth and postpartum doulas or even childbirth educators that will be serving families throughout the entire journey. But where can people find you if they want to connect or work with you in general?
I am on Instagram. I am at the NICU Translator. I'm there all the time. And I also have a website, which is www.thenicuTranslator.com. It outlines working with me one-on-one. I have a Life After NICU membership, which is for families who have experienced a NICU and then just want more information about how to support their babies at home. We have a community forum. We have experts come in and talk about meeting developmental milestones at home and recovering from a C-section. So that's on there. And then I also am offering like one-off workshops and courses too. So it's all there. And that's the best place to find me.
Awesome. Yes, I will link all that in the show notes. Thank you so much for being here. I love this conversation because I feel like it's not something that's talked about nearly enough.
Well, I appreciate you having me on
Yeah.
and having the conversation because I love to get the message out there and just make the NICU a little bit better for those that have to experience it.
You just finished another episode of Motherhood Flow. For more, head over to thehannahgill.com or on Instagram at thehannahgill. As a reminder, this podcast is provided to you for educational and entertainment purposes only. It should not be considered a substitute for medical advice. Until next time, keep flowing.